We're going to get this program started because we got a great program this afternoon. This is really, really special. Welcome to the launch of the 2012 Children's Miracle Network Hospitals Champion presented by Delta Airlines. My name is Gary Lincoln. It's my privilege to be here today. Columbia Regional Airport also lets us use the hangar. How about a round of applause for Columbia Regional Airport? Along with Delta Airlines, Ace Hardware also sponsor this program today, and the beautiful flowers are a result of Ace Hardware. So if you get a chance, go out and spend some dollars at Ace Hardware. Also, Chico's is going to help today with a little bit of a fashion show. So it's going to be a little fashion show with Chico's in a little bit. But before we do that, we're really excited to introduce this year's champion child for the entire state of Missouri. A remarkable young lady who's been selected to represent thousands and thousands of children that are served each year at MU's children's hospitals and other children's hospitals across the state. And her name is, I'm not going to do it quite yet. Before we bring her up here, there's another lady I'd like to bring up here to talk a little bit more about Children's Hospital and all the wonderful work they do there. Sue Rodgers is the Director of Nursing Services at the Women's Children's Hospital. Sue, to the podium.
He's a little taller than I am. Let me just say, I do fly Delta, I do shop at Chico's. So. Thank you so much for joining us to celebrate this exciting day for MU Children's Hospital and Children's Miracle Network Hospitals. I'm so pleased that Jayla has been selected to represent not only our hospital, but all children's hospitals in the state of Missouri. As the champion child, Jayla will represent thousands of children served throughout the state. MU Children's Hospital serves many families, some of who travel hours and hours to receive their services here in Columbia. Serving patients from virtually every county in the state and some beyond our state borders, we saw nearly 37,000 patients in 2011. Our patients come for a variety of reasons. Some are seeking treatment for chronic conditions like Jayla. Others arrive as a result of really traumatic injuries. But regardless of the reason, the hospital stands ready to meet the medical needs of Mid-Missouri's children. University of Missouri has a history of providing superior care to children. But that service reached new levels when we opened the Women's and Children's Hospital in September of 2010. Now, Children's Hospital operates as a standing facility rather than a hospital within University Hospital. And this move has allowed us to be much more child-centered. From the minute you walk in the lobby, you know it's a place for kids. Jungle Theme welcomes our patients and is carried throughout the hospital so that our facilities are less intimidating. Patient rooms are better equipped to meet family needs. They're all private rooms, and the 27 pediatric and 16 adolescent rooms are private. They include sleeper sofas so that moms and dads are able to stay with their children during the hospitalization. Now, hospital stay can be really long and tedious and frightening for a child, so each of the rooms is equipped with television, DVD players, Wii gaming systems in every room. Sometimes the docs don't want to leave when they're making rounds. In addition to pediatric and adolescent inpatient rooms, we also have a pediatric intensive care unit, which is part of the only Level 1 trauma center in Mid-Missouri. And in the neonatal intensive care unit, we took care of nearly 500 premature and critical infants in a year. We have the only dedicated neonate and pediatric transport team in Mid-Missouri, helping to ensure that no matter where you are, we can get you to the care level that they need. In August of 2011, the hospital opened a pediatric urgent care facility for those after-hours, non-emergency medical care needs. And it's the only one of those after-hours clinics that's actually staffed by a pediatrician. And the information on that visit is sent back to the child's primary care provider. The Thompson Center, which is also adjacent to the hospital, provides care for patients with autism and other neurologic disorders, and plans are currently underway to renovate and expand pediatric rehab services for children. With more than 30 pediatric specialties, MU Children's Hospital provides an impressive array of medical services. I believe what truly makes our hospital exceptional, though, are the people who work there. Whether it's the nurse who gently provides treatment, or the doctor who explains the procedures so a young child like Jayla understands what's going on, medical care is administered by people who are committed to providing superior care to children. The needs of a hospitalized child are more comprehensive than just what doctors and nurses can provide. Social workers, dietitians, and therapists all work hard to meet the variety of needs. And child health specialist staff members work tirelessly to help the children understand and cope with their conditions and hospitalizations. Hospitality services ensures patients and families have their comfort needs met and bring room service to families from our #1 nationally rated kitchen. Custodial staff help ensure the comfort of patient and families as well. I'm proud to say they are often identified by families as vital contributors to the hospital experience. In fact, Jayla has a special friend named James who cleans her room during hospital stays, but also stops to check in on her even when he's not assigned to her room. This is just one example of the remarkable and personal care that's the hallmark of MU Children's Hospital. I am so proud of the remarkable work being done at all levels there. While I wish that no child had to be hospitalized, I'm pleased to hear from children like Jayla that they love the hospital and count staff among their friends. And it thrills me to see a family like the Kemps who stop by when they don't need to be there, and they're doing well. Children like Jayla have a long and enduring relationship with the hospital. We see them frequently, and we truly become connected to those kids. We celebrate her successes and commit ourselves to addressing medical setbacks. That's why it's such an honor to celebrate this with her today. Jayla is just one of so many remarkable children who face challenges that no child should have to endure. She's a wonderful example of the resilience of ill and injured children. They are truly champions. And we are proud of her selection as Children's Miracle Network Hospital's Missouri Miracle Child. I hope she can say all that. Thank you very much for coming today.
Okay, now you know who it is, but you don't know how she's going to get here quite yet. Thanks, Sue. Missouri Children's Hospital benefits from a wonderful relationship with the Children's Miracle Network Hospitals. And as a national organization, the Children's Miracle Network Hospitals is able to raise awareness and funds that stay local and benefit our children. To tell us a little bit more about this collaboration, Molly Myers. Molly's a development officer for the University of Missouri Healthcare Systems.
And it is a great pleasure as we are here to recognize Jayla as the first champion child from Missouri from our local children's hospital. University of Missouri Children's Hospital is a Children's Miracle Network hospital. Children's Miracle Network hospitals are an alliance of 170 national children's hospitals. CMN was founded in 1983 by Marie Osmond and her family, John Schneider, Mick Shannon, and Joe Lake. They founded this organization on 2 basic principles. 1, help as many children as possible by raising money for children's hospitals. And most importantly, to keep all funds raised locally. 100% of funds raised by, I'm not sure, can anyone still hear or are we getting drowned? Okay. 100% of the funds raised stay local. No money is taken out for administrative costs, which is huge. That way we can use all the money on needs for the hospital. At the national level, so all of the Children's Miracle Network hospitals combined have raised over $4.3 billion. And at a local level, we raise around $500 million a year through our Children's Miracle Network partnerships. The interesting thing about this money is that most of it is raised $1 or $2 at a time. That's extraordinary when you think about the funds that are being raised and how it's coming in. The Champions Program is a national program sponsored by CMN. The mission of the program is to recognize children that benefit from Children's Miracle Network hospitals. Each year, 1 child is represented from